Hello, I'm EmmaLouise Coffey, and you're welcome to the Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights, and opinion to improve dairy farm performance. With calving at peak, farmers are busy and in need of vet assistance at times. The Moovet Eamon O'Connell joins us with insights and advice on the most common ailments he has seen on dairy farms since the onset of calving.
Everybody has started calving with a bang. The thing we are seeing then that comes along with that is a lot of cases of milk fever. So some difficult calving, some milk fevers, or sick calves and calf health probably won't kick off around here for another 3 to 4 weeks when there's a lot of calves on the ground and the weather starts to get mild and wet, and that's usually when calf disease comes to a head. But at the moment, yeah, some difficult calvings and quite a lot of milk fever.
And in relation to calvings, Eamon, farmers often second guess themselves, whether I call the vet for assistance or I just stay going myself when they're in difficulty. Have you a rule of thumb or some guidance into how you'd make that call?
Well, I suppose it varies a little bit from suckler cows to dairy cows, but your standard rules apply. I mean, first of all, you've got to give cows time, and some people's definition of time versus others can be very skewed in that a farmer would say, got to give her lots of time. But his time would be from, I saw her starting to swish her tail and I gave her an hour. Whereas realistically, our aim would be when a cow is actively progressing at calving. So as in you see what we call the first bubble or whatever, that she's settling down to calve, she's pushing. I mean, if you're in any doubt, put your hands in and have a little feel. If you can feel the legs and the head, like you need to give the cow up to 2 hours to progress as naturally as you can for those 2 legs to appear and even the tip of the nose to appear before you intervene. Now, obviously, look, when we get called to calvings, a lot of the time it's because they haven't progressed naturally. But some of the time we do get called to calvings where just people haven't given them enough time. And it's difficult for your vet when he arrives in the yard then and he has to weigh up the options at maybe say 1 o'clock in the morning and he might be busy. Like, this cow needs more time. The calf is alive. There's a delicate balance. Realistically, your first thing you should be thinking of is, I want the cow to come out of this as healthy as possible, because she's obviously what's going to keep you ticking over for the next 12 months. So she's the most important thing. So you don't want to intervene too early in a normal calving scenario and run the risk of maybe giving her vaginal tear or run the risk of her holding cleanings because of a tough calving. And obviously that'll have a massive knock-on effect on her performance and her fertility down the line. So I suppose the natural progression of calving, but if a cow if the legs and the head are there, she needs at least 2 hours of naturally progression to open up, I suppose, and to allow the calf to come as normally as possible. Obviously, if you put your hand in and you can't feel the 2 legs and the head, we often get called to there's a head back or there's a leg down. Definitely that's time to call the vet. But if everything is presenting normally and she just hasn't opened up and she's going about actively pushing and calving, well then time and lots of it often solves a lot of those ones,
So, Eamon, you mentioned that, you want the cow as healthy as possible post-calving. So looking at the scenario where you're on farm and you're faced with a cow that's in difficulty, how do you make the call as to whether you assist for a normal calving or you intervene with a cesarean section?
Well, I suppose it's easy to make the call when there's something obviously wrong. So, I mean, if there's, as I said, a head back, leg down, and you spend a short while, and when I say a short while, just a couple of minutes, if you can't rectify the issue, well then I'd be going straight to cesarean, because you want the best result. You don't want to spend too long messing about, not getting anywhere. I suppose it becomes a little bit more difficult when you're looking at the size of the cow versus the size of the calf, especially in suckler herds when you have a big calf and maybe a cow's pelvis and you're in that area where you're like, will I or won't I, And I always think back to an old boss. Is actually an old boss of my wife's, who's a vet as well, said you'll never be sorry for doing a cesarean. So if you stand back and you go, oh, this could be touch and go, well, personally I'd always err on let's go the cesarean side, because I mean the last thing you want is if the cow isn't progressing and the calf is presented properly, as in his head and his 2 legs are there, if she's not able to push those up on her own into the pelvis, well then something's wrong, and a lot of the time it's size is the issue, and we don't have the ability to measure at that stage or figure out what size the calf shoulders are, or worse again, what size his hips are. So, and look, everybody's been caught out. They've pulled the calf and they've got him so far and things have gone wrong. I think if you're in doubt, first of all, in any doubt, give the vet a shout. And then, I mean, if they're in any doubt, more often than not, they will elect to get the calf out with the least amount of trauma to the cow. Because I mean, yes, the cesarean is a serious surgery, but at least it's controlled, and we're getting very, very good results now in this day and age with cesarean sections in cows. So, and a lot of them are, a significant proportion of them are going back in calf afterwards. Whereas if you make the call and you start to jack a calf and it doesn't go well, then you can often have a cow down, or tears and that sort of thing, and they don't bode well for the future of that cow in the herd.
Absolutely. You also mentioned milk fever, an issue that you're seeing out on farms. Can you briefly explain what is the dynamic in the cow system that causes milk fever?
Yeah, as I said, we've seen an almighty amount of it in the last 2 weeks in particular, more than any other spring, I would think. But I suppose what happens with milk fever is on the journey towards the point of calving, the cow's body is getting prepared for what's coming. So what's coming is, I suppose, the big event of the calving, but straight away afterwards, particularly in these high BBI, high volume dairy cows, is the production of milk. And the production of milk, the birth itself and the production of milk all requires calcium, because calcium is responsible for muscle and muscle action, but it's also responsible for the production of milk, and it gets leached into the udder as part of the production of milk. So we're trying to prime the cow's body to be ready for that day when everything changes, So body condition, I suppose, is the first thing. It's important for all animals to calve down fit, not fat, I suppose, would be the very, very basic. Now, I won't get into the whole arguing over body condition score 3 versus 2.75, but the majority of farmers that will be listening to this will know fat cows versus over-fat cows versus thin cows, So your cow's in good enough body condition. And the second thing then is your pre-calving diet and its mineral content. The majority of guys would be familiar with using magnesium as a primer of the system. So magnesium, you feed enough of magnesium daily in the cow's pre-calving diet right up to calving in order to prime her system to be able to absorb calcium from the gut and to be able to leach calcium from her skeletal system, because that's where calcium is stored. It's stored in the bones. So as soon as she calves, there's a big draw on from the udder and from the active calving on the calcium store in the bones and on the absorption from the gut. So you're just trying to prime that system. And I suppose what we've seen quite a bit of from a veterinary point of view, if we start seeing 1 or 2 milk fevers in the herd, we'll get in and we'll take some bloods off of up close cows right up to the point of calving, and a lot of those won't have adequate enough blood magnesium levels in them. So you'd be looking at magnesium supplementation. The less common, but often a lot more talked about, would be putting in the likes of magnesium chloride and affecting the dietary anionic balance, called DICAD. Which tries to make the whole cow system acidic, in the hope that she will suck more calcium out of her skeletal system. But it can be more difficult to control, particularly in Irish grass silage diets. From a veterinary point of view, we'd always, or mostly anyway, focus on magnesium supplementation pre-calving, which can be difficult because a lot of the pre-calvers, a lot of the higher end pre-calvers even would have about 28% magnesium in them, and that means they're getting 28 grams a day if it's fed correctly. But I think some of the grass silage samples this year aren't coming back massively high in magnesium, so even extra supplementation is needed. But realistically, what we're seeing more and more in, I suppose it's more older cows in particular, more higher bred cows, higher bred for milk, they're really, really prone to get milk fever. And obviously said that the heavier they are, again, the more prone to get milk fever they are. And look, a cow with milk fever, a lot of guys will maybe go in with a bottle under the skin and see what happens. I think if you've got a good cow and she's got proper milk fever and she's down and she's not making a great effort to get up, I think give your vet a shout and get some calcium intravenous as well as under the skin, because the longer she's down, and particularly what we found of late, maybe she'll calve okay and she'll go to the parlour and then she might lie down at the back of the collecting yard, not able to get up. If they're having difficulty getting up, they can lose confidence, they can get a little bit sore, they could even injure themselves. So I think the earlier the intervention you go with milk fever, the better, we find anyways.
And like a question for you then, like say you're saying there's a huge amount of it over the last 2 weeks, so that would suggest that is potentially going to continue to be a problem on farms, for the rest of the calving season. You've identified a solution in terms of pre-calving. So for cows that are going to calve for the rest of February and into March, April, what is the strategy? Like, do you feed an oversupply of that dry cow mineral to try and prevent this?
Yeah, good question. I suppose what we would say is the less shooting in the dark you can do, the better. So if you're just looking at your pre-calving diet at present, if you don't have a mineral analysis of your silage that you're feeding your dry cows, you are shooting in the dark, you know. Like if you have a case of milk fever or two, it might only be a small imbalance you're looking at. It could be a significant imbalance you're looking at, but you really need to know what you're playing with in order to implement a control strategy. So first thing I'd be saying to guys is, look, you can do stuff in the short term. Yes, of course, you can up your pre-calving mineral supply. You could feed a little bit of sweet CalMag or something like that. But I'd really be inclined to, if you start that, figure out what your dry cow diet contains as regard minerals. And that's easy to do. I mean, there's lots of companies that'll do forage analysis and get it returned to you pretty quickly. So at least then you know, well, my cow's eating X kilos of silage. That means she's getting X amount of minerals. This is what I need to top it up by. Because, I mean, outside of the expense of feeding extra pre-calving minerals, I mean, there's also the fact that, I mean, if she only needs, for argument's sake, a little bit extra magnesium and you go lorry it into her diet, you can have adverse effects like scour and that sort of thing. So we'd always be keen on knowing what you're dealing with, if you know what I mean. I mean, you might know today and you might implement a strategy today, but by this time next week, you need to know, because you don't want to do something that you haven't got all the pieces of the jigsaw together. And I suppose the other thing is, look, there's lots of fellas there now at the moment looking at cows about to calve in the next week, and like they're 6 lactation cows, they might be 7,500 litre cows, and you're kind of going, right, she's old, she's going to give me a lot of milk, and she's over conditioned. I'm not going to be able to change that now. So, like, look, having the supply on hand. I mean, as I said, the bottles of calcium under the skin. What we've actually found really good is calcium boluses that you can give pretty much on the point of calving. So when she starts to calve, if you've got an at-risk cow, and I mean, some guys will know that they're cows that are at risk, that are carrying extra condition, or maybe she got milk fever last year. As I said, old, over-conditioned cows, high yielders would be the main ones. A calcium bolus at calving, and again, 12 hours later, makes a huge difference. I would caveat that with, you don't want to give calcium before they start to calve, because, as I said, you're trying to prime the system. You only want to give calcium when the system needs it. So when they are actively calving, or just after calving, and again 12 hours later.
And I suppose to move on, and not to, you know, really labour the idea of milk fever, but in a recent Farming Independent article, you would have described milk fever as a gateway disease. Can you tell us what you meant by that, Eamon?
As a gateway disease, what I would have meant by that is cows that get milk fever are way more likely to get lots of other conditions thereafter. So, I mean, let's just say you've got the ideal scenario, very satisfactory. The vet comes out, he gives his bottle of calcium into the vein, 2 bottles under the skin, cow pops up, off she goes. You're like, happy days, job done. Unfortunately for her, immediately she's increased her risk of developing other conditions post-calving. So she's more likely to develop ketosis. She's more likely to develop a left displaced or a right displaced abomasum. She's still more likely to hold her cleanings, retained placenta, metritis. Also, that dip in calcium supply affects their immune system. So if she's immunocompromised or her immune system is a little bit lower, she's more likely to develop high cell counter mastitis. I mean, it literally opens the gate and makes them a lot more likely to pick up an awful lot of other diseases, which, as I know, we do labour the point of milk fever quite a bit, and some people go, oh God, another guy talking about milk fever. But when in hers that do get milk fever, like, you're looking at, for every one clinical case, you might have up to 10 subclinical cases. So, I mean, if you've got a 100 cow herd and you have 5 cases of milk fever, there's a potential for up to 50 other cows to have subclinical milk fever, which obviously isn't visible to you, as in they're not down and they don't need calcium, but it's opened the gate to them being a lot more likely to developing mastitis, metritis, displaced abomasums, ketosis, all the conditions that we see in the springtime that make cows sick.
And I think, look, what you've talked about in terms of having the bottles of calcium and the boluses is something that on the point of calving or during the calving process, that, you know, you're potentially ruling that issue out for post-calving and further on into lactation. If we move on to calves, Eamon, you know, you would have referred to calf health, and I think it's interesting what you say. It's probably something that's coming down the track, not necessarily an issue on farms right now, but, you know, when the calf shed is full and the weather is mild. What sort of calf illness and disease is the most common things that you would be out on farm treating for?
Two most common things really, and for sick calves or for young calves, I suppose, and calves under 6 weeks probably is what we're going to be dealing with for the next couple of months. Most of the time, getting sick is scour and pneumonia. It's pretty simple. The first thing we usually see in people's yards are outbreaks of scour, like rotavirus being one of the most common ones, cryptosporidium being a horrible one that a lot of people are getting more experience of, and pneumonia would be the other condition. What we often see is everything is going fine on a lot of farms, and even in our practice at present, every spring is the same. We're tipping along, we're calving cows, we're doing the milk fevers, and the sick calf calls are quite low, and you almost get lulled into a sense of, do you know what, this mightn't be so bad this year. And then you get a weekend where it snows or where the temperature changes or where there's a storm and the wind whistles into sheds full of calves, and all of a sudden they're on the brink, because look, everybody's calving a lot of cows very quickly. There's a lot of calves on the ground. Facilities, systems are under a little bit of pressure, and the slightest change can push things over the edge. And next thing, 2 to 3 days after the weekend, we start seeing the scour cases starting to build up and the pneumonia cases starting to appear as well.
And how can we prevent this, in terms of practical tips that avoid this issue on farms?
It's always going back to basics, really. I mean, if you have calves, you have to, I always say we focus on treating calves like small cows when they should really be treated like babies, like almost wrapped in cotton wool for the first 5 or 6 weeks, because they're baby calves. Like, so, I mean, you're looking at the very, very basics. Air in the shed they're in, as in enough circulation of air where it's fresh, but there isn't a draft down at calf level. Calf comfort, dry bed. We always do the test, and we say to guys, look, if you can take your pull-ups off and you've just got your jeans or your trousers on, if you kneel down in the calf bed where the calves are, your knees should be dry. If your knees are coming up wet, well, then your calf bed is not suitable for your calves, and it's going to stress them out. And then nutrition as well. There's a lot of focus on nutrition of late, between different types of milk powder and different types of rates of it being fed, and whole milk versus milk powder, all that kind of thing. I think feeding enough makes a huge difference. A lot of guys are feeding the bear 2.5 litres morning and evening, and in reality, if you look at a 50-kilo calf, he's going to need that at a very minimum just for maintenance. And I mean, when the temperatures start to drop, I know where it's given to get cold towards the end of the week, or it'll be cold at some stage in the next 2 months, let's be fair. If you get down into the minuses, we're not going to escape. I mean, all of a sudden, calves that are on 5 litres of, let's even say 5 litres of decent whole milk, suddenly their requirement to keep themselves warm goes up by 1 litre a day. Not to mind the extra they need. And some people do get afraid of, the calf will get a milk scour. I think if a calf is healthy, he can drink ad lib milk. I mean, there's lots of suckler calves drinking as much as possible. And I know lots of guys that are feeding their replacement heifer calves up to 9 litres of whole milk or up to 900 grams of milk replacer, and absolutely no issues, So I think if your environment is right, the rest will follow suit. And I suppose then, look, you do have to branch into things. Once your environment is right and you're happy with your calf sheds and that they're dry and that they're clean and that they're warm enough but enough fresh air, you're looking at some of the vaccinations in from a veterinary point of view. I mean, a lot of farmers at the moment are vaccinating their cows for rotavirus, coronavirus, E. coli, and that the antibodies pass on through the colostrum into the calves, which at least gives them good protection against rotavirus scour in particular. But as well as that, we've seen a lot more cryptosporidium in herds of late, and we do find that vaccinated herds tend to fare better, simply because if a calf gets scour from crypto, chances are he's going to get rotavirus on top. But at least if he's vaccinated and he's got enough of antibodies, that's definitely going to help. Similarly, the pneumonia side of things, there are lots of pneumonia vaccinations out there for young calves, like that'll protect them against IBR, RSV, and other things like Histophilus, PI3, all those bacteria, Pasteurella. But look, a lot of farms will be different, so it's worth talking to your vet. But I think if the basics aren't right, vaccines don't fix it. So if your calf sheds aren't right, and even right back to your calving box hygiene, your basic principles of colostrum, if you're falling down there, well then I suppose all the vaccines in the world aren't going to fix an issue thereafter.
And finally, Eamon, like you've given us a huge amount of information and a lot of tips throughout this conversation. But a final thing, we often talk about being prepared for calving, and we might necessarily have all of the boxes ticked and all of the supplies in the yard. But for you, from an animal health perspective, what are the must-have products that farmers should have at hand in the yard this spring?
Look, I won't labour you with a big long list, but I suppose some of the basics from a veterinary point of view that we get called out would be like a supply of more than one stomach tube, like one for feeding colostrum, one for treating sick calves. At least you're not transferring over bacteria. A decent navel spray, chlorhexidine alcohol-based navel spray. So at least every calf's navel is getting dipped and treated, so you're not allowing bacteria enter through that. Something that's going to gain more and more popularity is, and your vet will advise you on it, but a lot of sick calves, we're obviously trying to move away from antibiotics. Even without the regulations changes, we're trying not to lob antibiotics into every sick calf. Anti-inflammatory medication makes a huge difference. Like a lot of calves that get sick with high temperatures, that kind of crack, when they get non-steroidal anti-inflammatories, temperature comes down. Equally, when they've scour and they've got a cramp in their stomach, some of those, that anti-inflammatory medication will definitely help. But again, that's on the advice of your vet, obviously. Look, I suppose the hygiene side of things is the big thing. We've mentioned having the calf shed clean and that, but I mean, having a decent disinfectant on hand, for argument's sake. And again, you can chat to your own vet about what bugs you have in the house, but being able to clean out your calf shed regularly and disinfect it does make a huge difference. I mean, some people will clean it out and rub the power hose on it. If you're not disinfecting, you're not getting rid of the bacteria. I mean, you can have a big long list of stuff in the yard, and historically people would have had bottles of X, Y, and Z ready, but I mean, that day obviously is gone. So I suppose we're looking at it from a preventative point of view now, as opposed to a reactive point of view if possible.
That's super, a hugely informative conversation. And I think, when we consider cow health, there's some key tips that you have presented to us in order to really get things right on farm today. Thank you, Eamon.
EmmaLouise.
That's it for this week's episode of the Dairy Edge podcast. And my thanks to Eamon O'Connell for joining me on this week's show. Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify. And for more information, go to the Teagasc website at teagasc.ie. I'm EmmaLouise Coffey, and join me next time for your Dairy Edge.